I am your presenter, Jane Galpan, and now we are going to discuss about the supervisor or manager's role in occupational health and safety for employees. So first, safety and our health refers to such thing as physical and mental health, stress, accident or incidents, and disease in the occupational environment. It includes facilities, equipment, people, and stresses, ventilation, heating, air conditioning, workspace, lighting, chemical, physical, biological, and radiological. So first is the preventive programs for employee. Initial health exam and periodic health exams are important in the employee's health and safety processes. Problems can be spotted early and then dealt with before they become severe. It is necessary to spot and cope with chemical dependence. Employee rehabilitation after an illness or injury is essential. A wellness program that emphasizes proper living styles, good nutrition, appropriate lifetime exercises, and relieving stress will help reduce illness, accident, incidents, and injury. So, for example, if you're applying in a government post or a position, uh, the first thing to do is they are having a initial health exam for them to know if the aspirant applicant has any problem that needs to be resolved before being hired. Next is the occupational safety and health, or the OSHA, is the Occupational Safety and Health Act of 1970. As a result of this act, the U.S. Department of Labor was given the authority to develop necessary rules and regulation to assure safe and healthful working conditions for all individuals. The Department of Health and Human Services was given the job of carrying out necessary research, developing proposed standards for a variety of hazardous substances, and making special studies were required. Now we are going to discuss about the tree inspector career tracks. So first we have the industrial hygienist. They give advice and assistance concerning environmental issues such as noise, biohazards, and dangers from chemicals. Next is we have the safety engineers. They review the technical compliance with health and safety laws. And lastly, we have the safety and occupational health specialists. They are concerned with employees' personal equipment for their job. The environmental issues such as ventilation, lighting, and equipment. They also conduct safety and emergency preparedness training for various industries. All three groups are college trained in their. Next is the effect of the OSHA law. It applies to manufacturing operations, offices, farms, services, organization, non-profit organization, and transportation. It covers 105 million employees at about 6.9 million work sites. The laws require that where you have a business or company that employs individuals other than your own family, you must follow specific rules and regulation, and that you must keep a log of all the cases of occupational injuries and illnesses, appropriate supplemental records, and post information concerning the OSHA Act. So it is enforced through routine inspection, evaluation of serious accidents or incidents or hazards, and evaluation of complaints. The Department of Labor through OSHA can issue citations and fines or can order abatement of specific problems. So here in the Philippines, we also have a department in which they are concerned with the occupational safety and uh, health. So, meron tayong isang department that is concerning in OSHA. So, for example, in the organization where I belong, meron doon na hospital for the uh, civilian and the uniform personnel. So, this OSHA is being applied in the hospital in which they are examining for the health and safety of the employees. General accident or incident problems. So in order to understand accidents or incidents and injuries, it is necessary to determine the who, what, why, when, where, and how of each accident or incident. First is to whom did it happen? Kanino nangyari? Anong nangyari? Bakit nangyari? Kailan ito nangyari? Saan ito nangyari? Paano ito nangyari? So it is also essential to evaluate all environmental factors that may have contributed to the accidents and incident and potential or actual injury. Equipment and processes should be part of the evaluation. So for example, let us give an example for this who, what, why, when, where, and how of each incident or accident. So for example, you're a policeman or yes, a uniform personnel. So kanino siya nangyari? So for example, we have a patrolman Juan de la Cruz. So sa kanya siya nangyari. What happened? A vehicular accident. Why did it happen? Because there is an unexpected situation that happened. So halimbawa, may tumawid na pusa or aso. So yun yung nangyari because of the unexpected incident. When did it happen? It happens when the patrolman is going to his house or pauwi siya ng bahay. Where did it happen? Nangyari siya sa isang hindi siya sa highway or nangyari siya sa isang eskinita papasok sa kanilang bahay. How did it happen? Because of the sudden appearance of the dog or a cat. So that's an example of a general accident. Accidents, injuries for all categories of people, including employees and non-employees. So there are a variety of causes for all accident or incident. These causes are based on the following factors. Sex differences. Males have 2 times as many deaths from accidents or incidents as females, primarily because they are more aggressive and more active. Age differences. The very young and the very old have a higher death rate than the other categories. The type of accidents also varies with age. For example, for children under the age of 1, suffocation is the leading causes of death, and for persons between the 45 and 65 pulse are the leading cause of death. Next is time. There is a seasonal variation with June and July as peak seasons, as well as November and December as accidents or injuries for all categories of people, including employees. Next is we have the environmental factors. So there are a variety of environmental factors depending on where the accidents occurs. So it can be the physical structure can lead to accident because of the design's construction, maintenance, or furnishing. So for example, in a construction site, so a physical structure can lead to accident is because of some incidents that is hindi overlook at nangyari yung some incident na yon or the accident. Next is the light and color the light and color affect the problems through the quantity and quality of light, the amount of glare in the color of surfaces. Noise can be a part of the accident. Next is the housekeeping leads to a variety of accident because of misplaced item, dirt, clutter, wet or slippery surfaces in cleaning equipment. So for example, housekeeping can also lead by that. So since minsan meron nakalagay na isang bagay doon tapos hindi sa pagkakaalam ng employee and non-employee wala yung bagay na yun doon. And halimbawa naglalakad siya, hindi niya napansin na nandoon pala yung bagay na yun. It may cause pwedeng mabangga niya or naging dahilan ng accident. Yung mga basang sahig can also cause accident. Next is the time of day and the day of the week seem to affect the accident rate, with higher levels occurring at the end of a workday and at the end of the work week. Since kapag napatapos na yung araw, nagmamadali na yung mga employee to go home, so it may cause a high level of accident. Humidity, heat, cold, and other atmospheric conditions and weather conditions contribute to accident also. Is human factor. Involve the nervous system and individual reaction time, his or her senses of vision, hearing, smell, taste, balance, and touch. So psychological factors such as mental illness, emotional problems, or just individuals' attitude and values may contribute to accident. A person feels that it will never happen to him or her and therefore does not use the proper safety equipment. So sa psychological factor, minsan uh, feeling niya, hindi ko naman kailangan gamitin yung mga safety equipment or safety gears. So, wala namang mangyayari sa akin. It means, palagay na siya, which is a very wrong practice in which, especially if you are doing a physical job, especially in the construction sites or in the hospital nowadays due to the pandemic. So, kailangan natin ng mga safety equipments para maprotektahan yung ating sarili. Next is we have the anatomical features of the individual such as his or her age, center of balance, body build, and so on affect person in accident or situation. Certain physical problems such as muscular problems, nervous system problems, balance problems with body structure as a result of disease, as well as psychological problems such as high blood pressure and diabetes contribute to accident and incident. So how does these physical problems can contribute into sudden accident? So hindi naman natin sa hindi naman sa so for example, sa high blood pressure, so when a person is he or she forgets to drink or to take their maintenance, it can cause into accident or incident, especially if they are working continuously. Pwede siya mag-cause ng accident to the person suffering from high blood pressure and diabetes. Next is the variety of temporary human factors involves causation. They include alcoholism, fatigue, anosmia, or inadequate oxygen in the blood, mood, personal stress, and emotional upset, acute disease, drugs of any kinds, including prescription drugs, the time since food consumption, and morale. So how can these temporary human factors can uh, uh, involve accidents? So for example, you are working and pumasok ka ng nakainom, and you are doing a manual labor, manual labor and pumasok ka ng laseng. It may cause accident or incident since you're not in your perfect working mode. So, pwede kang makakause ng accident, hindi lang para sa sarili mo, pwede rin dun sa ibang tao or katrabaho mo. Yung fatigue or yung pagod, pwede rin siya makakause ng accident since hindi perfectly fit to work your body. So that is an example of it. Occupational, vocational accident incident factors. So the causes of an accident incident may be due to an unsafe act. So unsafe condition, poor or inadequate supervision, or poor training on the part of the individual. An unsafe act would include operating equipment without authority. So, you are operating an equipment without the authority of the higher person. So, failure to secure against an unexpected movements, operating or working at an unsafe speed, failure to warn or signal, removing of or making safety devices inoperative, using defective tools or equipment, using tools or equipment in an unsafe manner, taking an unsafe position or posture, servicing equipment while it is in moving or energizing form, riding hazardous moving equipment, participating in horseplay, distracting people and startling people, failure to wear personal protective equipment or wearing improper garments and jewelries. So, these are the factors in occupational. So, ito yung mga gagamitin natin yung mga equipment ng walang authority. Yung paggamit natin ng authority ng hindi siya safe na speed or yung gusto ko na matapos, mamadaliin ko na to. So, yung pagtatanggal natin ng safety devices or safety equipment sa ating katawan, yung paggamit ng mga sira ng tools and equipment, yung mga yung pag-upo or yung pag-posture natin ng mali. In the office, we have the ergonomic position in which hindi tayo dapat nakaslouch because it will cause back pain to us. And yung failure to wear personal protective equipments at yung pagsusuot ng mga garments and jewelries while doing. Next is we have unsafe act is caused by a lack of knowledge or skill, a lack of hazard awareness, a lack of job competency, or lack of coordination or practice. So unsafe act is caused by a lack of knowledge in doing our job. So it may cause accident or incident to ourselves and even to the people around us or sa mga ka-coworker natin. Next is we have unsafe condition may be due to the following: deterioration or corrosion of equipment or facilities. So as an employee, we should know that our employees equipment or facilities are in a corrosion or deterioration or medyo nagkakaroon na siya ng damage. Next is lack of proper degree of supervision based on the employee's experience or skills. Poor morale, lack of in-service training, and other factors contributing to accident are lack of adequate physical, visual, audio, and emotional examination prior to employment and during certain periods of employment. So, for example of this, in pagpapasok ka as a police or uniform personnel or you're applying for the being a soldier, ang una-una nilang tinitingnan dyan is yung adequate physical, visual, audio, and emotional examination. So, for example, for the physical, you need to be physically fit to do the job. Your visual must be clear. Hindi ka dapat nakasalamin. Kailangan clear yung eyes and good eyesight. Hindi ka bingi. Walang something na problem sa iyong tenga. And your emotional examination or yung tinatawag natin na psychological test. So, they are undergoing those tests bago sila ma-hired as a uniform personnel to avoid certain problems in the progress. So, to avoid unsafe act. So, as a supervisor, we should know how to deal with this kind of unsafe act. Accident or incident investigation. So it should be carried out by the first line supervisor and if necessary also by the special safety officer or safety committee as soon as possible after the accident has occurred. It can make note of the following: the name, the sex, age, and physical condition of each of the individual involved in an accident or incident. The date of the accident or the incident, the time of the accident, incident, make sure you show up AM or PM, a brief description of the accident, the potential physical causes or environmental factors, the potential unsafe act, the personal causes such as lack of knowledge, poor attitude, and physical or mental problem, others who may have been involved, your evaluation of the situation and how best to prevent it from reoccurring. This information should be entered. So, for example, I will give you an example of this type. So, halimbawa, we have a problem. It is a death of a uniform personnel, for example. So, kukuhanin natin yung pangalan, yung kasarian, yung edad, yung physical condition ng mga individual na involved dun sa accident and or dun sa incident, kung kailan siya nangyari, kung anong oras, at kung ano yung brief description ng aksidente. So, for example, wag na yung death. Example is we have a shooting incident. So, the shooting incident, ibibigay mo yung brief description. Ano yung nangyari dun sa brief description na yon. Ano yung naging potential na dahilan nung shooting incident na yon. So, for example, shooting incident happened in the rural area in somewhere in region 13, something, halimbawa lang natin. So a shooting incident happened in region 13 in which a patrolman shoot a civilian at night. So halimbawa, binaril niya yung isang civilian sa gabi. Ano yung naging dahilan or naging physical or environmental condition kung bakit niya ginawa yun? So halimbawa, lasing si patrolman, kaya niya nabaril, nagkaalitan sila. So that is a brief description of the accident. It happens at 10 p.m. So that is an example. It happened at 10 p.m. March 1, 2002. So 2002 or 2022, 10 p.m., a shooting incident happened in somewhere in region 13. The potential cause of this is due to a conflict because of conflict dahil nagiinuman sila. The potential unsafe act, so you are going to determine the unsafe act. So halimbawa, lack of knowledge na, or hindi naman siya lack of knowledge, basta you make sure to know the unsafe act na ginawa. Know the personal causes such as lack of knowledge or poor attitude and physical or mental problems. So dito papasok yung alcoholism na problem, which will be in the physical or mental problem. Other who may have been involved. So sino yung naging involved dun sa shooting incident? So yun yung taong nabaril niya. And your evaluation of the situation and how best to prevent it from reoccurring. So ano yung dapat mong gawin para hindi na maulit yung mga ganong pangyayari? We have the safety rules. Attempt to develop a new safety record. Buy proper safety equipment and clothing for employees. Develop a feeling of pride in the safety record of the organization. Make safety the team for work as well as home. A safety rules is determine which individual most frequently have accident or incident. Have regularly scheduled fire and safety meetings. Investigate all accidents and incidents very carefully. Check the environment by means of a self-inspection program for all the potential accidents. Develop a variety of poster contests and so in the safety areas. So kung makikita natin in our working areas, meron tayong minsan na nakikita doon sa stairs, may nakalagay dyan na stickers na pwedeng, yung parang sticker siya na nag-i-indicate that stairs can be slippery at times, pwede tayong madulas at huwag tayong magmamadali. So meron din tayong makikita ang ibang safety hazards posters in different areas. So, halimbawa, dun sa mga electronics, dun sa parang pinaka main switch ng isang building. So, makikita natin yung mga signs that gives us a safety, binibigyan tayo ng warning regarding those electrical switch. So make safety an intricate part of the workstation. When given a department maintains a good safety record. Safety program. Establish a safety committee. Require proper physical exam for new personnel. Also require periodic physical and psychological examination where necessary. So as I have mentioned a while ago, kapag bago ka palang papasok in a government post, or even in a private firm, they are doing a proper physical exam for the new personnel na papasok sa kanila to ensure that their new employees are fit to work. If not, kailangan muna nilang magpagalingin kung ano man yung sakit na meron sila. So, for example, meron kang UTI. So, hindi ka nila kagad i-employ. So, kailangan mo munang gamutin yung UTI before they are going to employ you. Next is proper adequate training for all individuals. Provide a job safety analysis for each particular job. Use safety engineer to build safer equipment and develop safer process. Make frequent inspection using adequate types of self-inspection forms. When individual will not conform to safety rules, use appropriate counseling and then disciplinary action. Investigate When injuries occur, the individual should be given prompt medical treatment. When an individual has returned from either sickness or injury, he or she should be evaluated medically to assure that the person is able to work to perform the job without causing an accident. So example of this is halimbawa, when a uniform personnel is uh, nagkaroon siya ng injuries or accident during the line of duty. So they are giving a prompt medical treatment. Yun ay dadalhin sila dun sa hospital inside the camp or camp pyramid to be given a proper medical treatment for them. Or kapag hindi naman siya kaya, i-refer siya sa ibang hospital. Then kapag pumasok na yung individual na yun or they are babalik na sila sa work, they are given a i-evaluate mo na sila to make sure that the person can perform their job. Again, build morale within your organizations. It can reduce a level of accidents. Keep proper accident incident record. Use good public relation techniques within the organization and with the public on all areas of safety. Periodically evaluate the program to make sure that the role of the supervisor or the manager is to do the following: inform the employees about good safety practices and how and flow to achieve them. Determine whether the individual have qualification to carry out the work they are doing. Be trained in the area of first aid and fire prevention and where necessary to help train others in this area. So in the government where I belong to, merong mga employees that are na kumukuha ng seminar or training para sa quick response or emergency first aid kit. Kung ano man, halimbawa may mangyari man, merong mga trained personnel na pwedeng alam yung first aid at kung ano yung dapat nilang gawin during a certain situation. Act as a role model for good, safe practices. Evaluate the environment of the work area to make sure that the individual environmental condition will not contribute to accident. Note whether certain employees are having emotional problem which may lead to accident. Work closely with safety committee to not only determine what the accident is but to push the safety program. Make the necessary investigation when accident occurs. Work with individuals who had an accident to a point where the situation our discussion. So for our assessment for 20 points, so read the situation and answer the following questions regarding the situation happened. So have a good day and thank you for listening.